insured by Health New England, number one, they could see their rates go up.
Health New England's chairman says the Affordable Care Act, or Obamacare, is penalizing smaller insurance companies and could ultimately increase how much some of us pay for insurance premiums. 22 News I-Team reporter Ryan Walsh found out if this could impact who Health New England insures.
Bay State Health President Mark Kerouac, who's also the chairman of the board for Health New England, says we shouldn't disrupt the system that's already working. He told the I-Team a provision in the Affordable Care Act is threatening how affordable our health care is. A provision in the Affordable Care Act called risk adjustment is forcing Health New England to rethink who it insures. The 22 News I-Team spoke with Bay State Health President Mark Kerouac.
What risk adjustment is attempting to do is to estimate which insurance company has the sicker patients.
The health insurance companies that have sicker patients would be paid an adjustment directly from other insurance companies.
How much money are we talking about Health New England potentially losing?
The estimates that we've gotten for the state would have been about $14 million owed for calendar year 2014 and about $30 million owed for calendar 2015.
Would it force you to rethink how Health New England is run, or if it's run at all?
I personally think that Massachusetts ought to be given a waiver from the federal government because we've been in health reform for so long. We've been ahead of the crowd here, and we really ought not to be penalized for it.
Bay State's president told the I-Team they'd be forced to pay Blue Cross Blue Shield big money that they'd rather spend here.
Having to write a check to a well-off company in Boston instead of using those monies to benefit our community right here in Western Mass would really be a problem.
Bay State's president isn't saying they're considering leaving the health exchange anytime soon. He's hoping the state requests and the federal government grants a waiver to reduce or remove these payments.
How might an individual person be impacted by this?
Ultimately, if the rule continued in effect, we probably couldn't continue to provide insurance to that segment of the market.
This wouldn't affect all Health New England subscribers, only the individuals buying insurance off the Healthcare Connector, as well as employees of small companies. Kerouac said any decision they ultimately make likely won't impact their 300 employees. The next step for us is to speak with the Health Connector Board to see if they have a plan to ask for a federal waiver. I'm Ryan Walsh, working for you with the 22 News I-Team.